Hello and welcome to Oromia Broadcasting Network English News Time. I'm Ulkabound Muba heading the news for you. Stay with us. A delegation led by Vice President of the Oromia Regional State Shimallis Abdiisa visited Oromia Media Complex, which is under construction in Finfinne City. A project underway by China State Construction Engineering Corporation exceeds 50%. The project is being under construction with a cost of 1.5 billion.
A delegation led by Vice President of the Oromia Regional State Shimallis Abdiisa has visited the Oromia Media Complex, which is under construction in the capital Finfinne. The construction of the complex commenced in 2018 with an outlay of 1.45 billion. On the event, board chairperson of Oromia Broadcasting Network and who is also head of the Oromia Education Bureau, Dr. Tola Bariso, stated that through observing the construction process, directions has been set to speed up its construction. In order to finalize this construction as per schedule, we have identified some directions. The first one is that suppliers of materials should properly provide the necessary material on time. We will also deal with Finfinne City administration to create conducive environment to fasten the construction of the complex. Director General of Oromia Broadcasting Network, Zinabo Asrat, on his part, pointed out that the project that reflects the culture and history of the Oromo people, the Oromia regional government has been followed up with due attention. The finalization of this project has greater role in realizing the openness vision because we have planned to disseminate programs in various languages of the country. Now Open has got license to be international media and started transmission. So this media complex has been underway in international media standard. It has greater role to succeed our plan. Consultant of the project, Engineer National Gatetown, underscored that works are well in progress to complete the construction on February 2021. This media complex has 7 studios which will serve for different purposes. Hopefully, we finalize its construction within a given time. The construction of the media complex has reached 15%.
Ethiopia and the United States have signed an agreement on law enforcement and administration of criminal justice. The agreement was signed by Muferiat Kemil, Ethiopian Minister of Peace, and Michael Reiner, Ambassador of the United States to Ethiopia. According to the Ministry of Peace, the agreement is aimed at improving the justice sector in Ethiopia through building capacity of law enforcement organs. The Chance government has provided agricultural equipment worth more than 4 million to the Ministry of Agriculture of Ethiopia. Ambassador of China to Ethiopia, Tanjan, handed over the equipment to the Minister of Agriculture, Umar Hussein. Among the agricultural implements include tractor, sowing and loose soil machines, rice and wet treasures machines, cotton seeds removing machine and generators. The agricultural implements are vital to modernize and improve productivity of the agriculture sector, said the ministry. State Minister of Health, Arla Abdullahi, said research-based works are being carried out to improve this current health policy. Relevant discussion and conference has been held in Finfinne City.
According to data gained from Ministry of Health, the ministry has been revising its policy after 20 years to give quality and swift health service. Accordingly, scholars have presented different research papers related to the policy on the conference organized by Ministry of Health. State Minister of Health, Saralla Abdullahi, on the event said, ensuring quality and equitable health service delivery requires research-based effective evidences.
The government of Ethiopia has demonstrated unwavering commitment to ensuring access to essential primary health care services for all segments of the population in the country. This has led to the rollout of the flagship health extension program for more than 2 decades. Now, with this clear impact of maternal, child and reproductive health of women and children in the country, in the era of implementing the health sector transformation plan, the Federal Ministry of Health implementing is even more committed to ensuring provision of equitable and quality maternal, child and reproductive health services. However, realizing the goal of ensuring quality and equitable health service delivery cannot be fully achieved unless decision making in policy and practice in evidence-driven. Today, as we meet in this significant event, we have to step back in rethinking the role of evidence in policy and practice for the Ethiopian health system.
Maternal and Child Health Deputy Director at the Ministry, Leah Wonderson, said results from academicians and implementations by decision makers and health actors should be further enhanced and integrated.
There is high need in strengthening collaboration, the collaboration between academia and health decision makers. As RMC Chain Directorate, we have long-term plan to pave ways by bridging the gap and connecting researchers with the decision makers. This today's research conference is model practice of our plan. We host this very important conference every 2 years in order to create a connecting platform between public health institutions or public health practitioners and academic institutions.
Different research papers have also been presented by various stakeholders. The research revealed that maternal death has been increasing due to lack of proper treatment.
በኢትዮጵያ ውስጥ ለእናቶች ሞት በጣም ከፍተኛ ሚና እየተጫወተ ያለው የእናቶች በወሊድ ጊዜ የደም መፍሰስ ወይም ከወሊድ በኋላ
The main cause of maternal death is blood bleeding before birth and after birth. To control it, medicine has been given 3 times, but according to my research, it is better to give once a time to solve the problem.
The research also stated that adult and youth health services has been increasing across the country.
Comprehensive death is declining from time to time according to our research. It is decreasing with 0.5%. There is also improvement on family planning. However, there are still youth who have been taking family responsibility at their early age. This should be improved because it can affect their health.
It is said that the Advisory Council established 4 years ago under Maternal and Child Health makes systematic research analysis on maternal health, child health, immunization, neonatal health, family planning, and early childhood development, as well as prevention of mother-to-child transmission of HIV virus.
The Oromia Health Bureau announced that it is working to accelerate the construction of delayed projects. Its Shawdon Health Office said in the coming years efforts will be done to improve health service delivery system. Addis Asafa.
Ishawa Zonal Health Office has held 2018-19 work evaluation in Mojo Town. Based upon the evaluation, the zonal has showed a dynamic improvement in preventing and mitigating communicable diseases. The work done on preventing HIV/AIDS is really promising. However, shortage of pharmaceutical, medical equipment and lack of commitment by health practitioners were some of the gaps of 2018-19 working year. Health practitioners asked the gaps to be filled by the concerning bodies.
In many health centers, most of the complaints are related to wastage of money, which emanate from weak financial administration. It is really surprising in a given health center, one individual may function as health practitioner, money collector, treasurer, and purchaser.
Most of all, our follow-up and support has got weakness because there is no any immediate assistance for health extension practitioners. This is what we have taken as the greatest challenge, and we have learned a lot out of it.
Head of East Shawa Zonal Health Office Mabratu Asafa noted that though there is progress in preventing and mitigating communicable diseases, there is malaria outbreak due to this rainy season. Mabratu further noted that the office would work on the gaps noticed during 2018-19 work performance evaluation.
By alleviating the aforementioned gaps, we will work to bring a strong ties between health centers and health extension practitioners. We will let the extensions go in depth to help the people. In addition to this, by mobilizing leadership committee, we will achieve district transformation agenda. Whereas we are working on preventing malaria outbreak that occurred due to this rainy season. Not only malaria, we also work on HIV prevention too.
Vice Head of the Oromia Health Bureau, Mengistu Bekkala, said that the health sector has showed improvement in Oromia. Mengistu further said that the delayance of health project and pharmaceutical supplies would be solved soon.
There are some delayed projects. The people notice unfinished projects, especially hospital and health center construction are common. This would be finished soon. We will allocate budget for it. The delays happened due to different reasons, such as lack of construction supply materials and problems of construction, are among others.
A recognition has been given to health centers and practitioners of East Shawa Zone.